الله بتشرفونا، إن شاء الله بتشرفونا كلكم مع الجزائر. Hopefully there will be an event حيكون في مؤتمر بالجزائر soon وحنكون إن شاء الله مع تواصل مع النقابة الفلسطينية ونعمل تسهيلات للفلسطينيين اللي تشرفونا بالجزائر إن شاء الله بتكون مثيرة. مش هطول عليكم كثير. I'm going to try to move on and start talking about what you're here for, veneers. So porcelain veneers from A to Z. طبعا الوقت ضيق and I know you're tired, you had a long day, so we're going to try to make it as simple as possible. طبعا I've been lecturing about veneers for the last 14, 13 years. And وصلت لconclusion انه الطريقة الأمثل ليستفيد الطبيب انه we speak the same language ونحاول نحكي لغة سهلة، لغة سلسة تستفيدوا منها. طبعا أنا معاكم من 10 بالليل إذا بدكم، ما عندي مشكلة. بس بعرف إنه بعض منكم ساكنين بعيد and you might have to come back. So I'm going to try to speed up the process and introduce a new concept, a way of doing things that's a little bit different. طبعا إحنا we live in an era where ceramics have developed a lot. We have a new generation of bonding systems available in the market. صار فينا نعمل veneers with minimal thicknesses. Minimal thicknesses reaching thicknesses of 0.1, 0.2, 0.3 millimeter. طبعا that's how thin we can do that. هذا الحكي ما كان موجود من 5 سنين. So we have a new generation of ceramics that can be manufactured in very minimal thicknesses. But to guarantee the longevity of these restorations, it's very important to have precision, in every step of the way. Every step of the way should be precise. That's why magnification is a must. That's why we have to have well-finished, highly polished preparations. In preparation تبعنا, if there is any kind of roughness, إذا في أي منطقة مش منسى أو أي خشونة, the veneer could break during bonding when you do minimal prep veneers. So minimal prep veneers is what guarantees longevity. And we all do veneers. يمكن عاملين في منكم عاملين veneers for 25 years. The way we do veneers nowadays guarantees bonding على الenamel, which is called a mina. Because the only way you can guarantee that your veneer will last on the long run is to be bonded on a large amount of enamel. So preserving tooth structure is what you should target. طبعا أكيد when we do veneers we have to understand إنه سماكة الفينير varies على عكس الكراون. When you guys prep a crown, you prep مثلا if you're doing a zirconia, of course infused to zirconia, you prep 2 to 2.5 millimeter depending on the type of material you're using. إذا عم تعمل monolithic zirconia you prep a certain amount, but it's a uniform amount of preparation. When you do a veneer, the depth of preparation, طبعا لما بنحكي depth of preparation نحكي معناتها ايش؟ thickness of the veneer. The depth of preparation will vary from the cervical to the incisor. بنوصل سمكات 0.3 ملم بالسيرفايكل وبنطلع تدريجيا to 0.7 0.9 ملم حتى 1 ملم بالانسايزر ثيرد. واحنا عارفين انه سمكه المينا the thickness of enamel اصلا varies. The enamel is thin بالسيرفايكل area وبيزيد تدريجيا ليوصل ل 2 ملم مرات بالانسايزر edge. So if you prep 1 mm or 1.5 mm from the incisor edge, you're still on enamel. So the whole lecture, حتى our workshop on Saturday inshallah is going to be focusing on how to preserve enamel, how to cut whatever is needed of the tooth structure, لأنه هاي الطريقة الوحيدة اللي احنا ممكن نضمن فيها إنه الفينير يطول على مدى بعيد. When I do veneers in my practice, I expect the veneer to last 25 years. One of my first cases, أول حالات كانت والدتي 6 veneers 19 years ago, still intact, because I preserved enamel. حافظت على الانامل and I guarantee that on the long term I obtain longevity. بس قبل ما نحكي عن preparation techniques وعن impression وقبل ما نحكي عن technical parts خليني بس أركز على موضوع how important a smile is. How a smile reflects someone's personality. How a smile becomes an integral part of someone's identity. كل واحد فينا إذا طلعتوا على بعض وبلشتوا تبتسموا كل واحد فينا له ابتسامة مختلفة عن الشخص اللي حده. We have different smiles and our smile زمان كنا نحكي هوليوود سمايل ما بعرف إذا عدى عليكم الكونسبت of Hollywood smile, which is a silly concept. It's a concept where عندك الانسايزر edge of all the anteriors على نفس المستوى. I don't believe in that. I believe in a customized smile. I believe that each one of my patients لازم ياخذ ابتسامة تناسب شخصيته. It speaks the patient. It matches the face. So to do that, I have to do a study. When I give courses بقعد مع الدكاترة بنقعد يومين 3 workshop hands-on preparation. بعدين بقول لهم اسمعوا يا جماعه الخير الجاي اللي who serves coffee بالفندق ممكن نجيبه يقعد معنا يوم ويطلع preparations احلى مني ومنكم. At the end of the day, what matters is the treatment planning phase. Treatment planning is the key. And the most important part is how to treatment plan. You know, when you do veneers, and I've been doing a lot of veneers, وبرضنا بدبي are very demanding. When you do veneers, الفكرة تبعك and you want to know what the end point is. So what we're going to focus on is to know the end point and climb your way up. Try to تبلش من النهاية والنهاية هتوديك لأول خطوة اللي هي preparation. This is what was introduced in 2014 or 2015 by Dr. Gary Burrell, who introduced the visage smile concept, which is defined as being the creation of a customized personal image that expresses person's sense of identity. It sounds too complicated. طيب شو معناتها؟ معناتها إن دكتور جالي بيوريل لقى طريقة تستند على an old concept اسمه الفيزاجيزم concept. الكونسبت الفيزاجيزم كان بالسبعينات تقريبا, where psychologists, psychiatrists, plastic surgeons قعدوا مع بعض and they determined personalities and temperaments, شخصيات المرضى لأربعة categories: strong, dynamic, delicate, and calm. Those were the four temperaments described by psychologists and psychiatrists when you analyze the personality of the patient. فدكتور جالي بيوريل شو عمل؟ He kind of implemented the concept of visage smile. Visagism اللي هو كان يحكي انه شخصية المريض تتوافق مع شكل وجه المريض. فمثلا someone who's strong would tend to have a rectangular face. Someone who's calm will have a square face. Someone who's delicate will have an oval face. Someone who's dynamic, هيك, will have a triangular face. ولقوا انه في correlation up to 88.6% matching together شخصية المريض مع شكل الوجه. Okay, what is it to me? شو علاقة هذا الشيء اللي أنا as a dentist? How do I transfer the shape of the face and the personality of the patient into the patient's mouth as teeth? How do I transfer the macro aesthetics of the face to the aesthetics of the teeth? How do we do it? Simple. You can buy a software, or you can just do a small analysis. طبعا the older ones will agree انه احنا اصلا كدكاتره اسنان we're trained to do a lot of psychological profiling. يعني if you've been practicing in your practice and a patient comes in متردد وخايف, you can tell. If a patient is a troublemaker, you can tell. If a patient is very demanding and high expectations, you can tell. So we are trained to do some psychological profiling. Through a very short video of your patient, you will see models later on. 40 to 60 seconds, you will be able to determine the personality of your patient. اللي هم four temperaments: strong, dynamic, delicate, and calm. And the same concept described in visagism بالسبعينات will be implemented على الأسنان, where you will think of someone who's, for example, dynamic, راح تفكر تعطيه triangular central incisors. Someone who is strong, راح تفكر rectangular central incisors. Someone who's calm will be square. Someone who's delicate will be oval. Don't get me wrong. This video is not about you determining إذا مريضك is obsessive compulsive ولا schizophrenic ولا عنده مشاكل نفسية. هذا مش دورك. Your job as a dentist is to decide and determine which part of the patient's personality shows more in public. How does your patient, كيف المريض تبعك بده الناس تطلع عليه؟ هلا ممكن يكون strong و dynamic. But what does he want to show more? And it's very easy. It doesn't take long. Within 40 seconds max, you will be able to determine that. And this will decide the shape of your central incisors. شكل central incisors. طبعا أنا دائما بركز على central incisors. تعرفوا ليش؟ لأنه when you do a smile design, حكينا على treatment planning, and the first number one step of the treatment planning is a smile design. When we do a smile design, the first thing we get, or we do, is the central incisors. You get the central incisors right, everything else is going to be right. You get it wrong, everything else is going to be wrong. معناتها إيش؟ معناتها if someone مثلا is, through the video, we will see models, patient is strong. I decided to give him rectangular central incisors. I have to keep in mind that they will be rectangular following the golden proportion of the central incisors. تعرفوا شو golden proportion of the central incisors? 75 to 85%. معناتها إيش؟ إذا طول السنترال 10 مللي معناتها الارض بده يكون between 7.5 و 8.5. بتقسم هذا على هذا بتضرب ب 100. That's how you get your percentage. تمام؟ So I have a key is the golden proportion of the central incisors. I decide what شو الطول وشو العرض. And I've done this for a long time. But then I reached to a conclusion that instead of deciding what the length of the central incisor will be on an image, on a 2D or 3D image, I can decide the length in the patient's mouth. So I started doing direct mock-ups. The first thing I do when a patient comes for veneers or for a smile makeover, سواء veneers or crowns, عشان أحدد, what I do is I do a freehand composite. I just put composite on the incisal edge, no bonding, no etching, like cure. I decide when would be a new position of the incisal edge تكون. Once I establish الطول, بضل عندي إيش؟ loud, which is easy to calculate following the 75 to 85%. But الطول, when I decide it in the patient's mouth, I can check. طبعا once I lengthen the central incisors, I can check the relationship of the edge with the lower lip curvature. I can check phonetics, speech, occlusion. I'll check anterior guidance. هل في interference بالاocclusion when the patient moves the jaw forward, pronunciation of the letter S, V, F. All this is tested inside the patient's mouth. Because you have to understand, one of the number one things we think of when patients come for a smile makeover is to lengthen the central incisors. لما نطول السنترال incisors automatically بتصغر شكل المريض. طبعا في بعض الحالات مرقت فتره كان عندنا موضه بدبي بيجوا بيقول لك بدي باجز باني تيث رابت تيث اسنان طويله. I don't mind. انا ما عندي مشكله. When you do veneers, you have to understand that dentistry changes. When a patient comes عنده ألم بسنه بده روت كانال، أنت كطبيب رح تقرر تعمل روت كانال. It's not something you can debate on. You're the doctor, you decide. لما مريض بيجيك بده extraction, you'll do the extraction. If he needs a filling, مش هتعمل له روت كانال بس عشان المريض قال لك اعمل روت كانال، صح ولا لا؟ This is dentistry. But when the patient comes for a smile makeover, this is elective dentistry. It's not the same. What the patient wants, you have to take it into consideration. عشان هيك, the first thing I do when I have a patient who comes for a smile makeover is to listen to the patient. بسمع. بعد اسمع المريض، تفضل احكي. شو اللي بدك اياه؟ What is it that you want to change about your smile? بدك تغير لون الاسنان؟ بدك تغير الشكل؟ طب اللون بدك اياهم فاتحين افتح. What's white? Is it B1 white or is it BL1 white? Because this will decide how big my treatment is. Do I do veneers على upper بعمل طبيعي على lower? I don't like doing veneers on the lowers. I'm not a big fan of veneers on the lowers. لو الاسنان اللورز صغار ما في عندي انامل، occlusion forces كثار. I'm not a big fan بصراحة. ف I wouldn't do it unless I have to. بس إذا مريض بده BL1, I have no choice. I have to do upper veneers و lower veneers 10 فوق 8 تحت ولا 10 فوق 10 تحت حسب حدد الأسنان اللي بتبين بالابتسامة. ف I listen. And I always say give them what they want. إذا بده إياهم BL1 حتى لو أنت شايف إنه مش حلوين, this is what they want. Test it before. Test it on the mock-up. اعملوا mock-up باللون اللي بده إياه. But if they want the BL1, give them BL1. Give the patient what they want as long as what they want does not compromise your treatment, ما بيأثرش على العلاج, and does not compromise the patient's health. This is very important. مثلا المريضة اللي بدها باجز باني تيث اسنان الرابع تيث طوال. طب إذا عملت لها اسنان طوال وطلعت من 75 to 85%، معلش I will not follow the 75 to 85%. مش راح امشي معها. بس لما عملت الموك اب I tested بتم المريضة. So the mock up is a test drive of the smile. رح نحكي وحنشوف صور بعدين. لما عملت الموك اب شفت انه والله على الانتيريور جايدنس في انترفيرنس. طب انكسر الكومبوزيت. معناته I cannot give them this long. So here I don't follow the patient's desires because the patient wants it long. But if it's going to compromise my treatment, I'm not going to follow this. I can try to find alternative solutions. حلول بديلة زي ايش؟ One way of giving the impression that the centrals are very long is to increase شغلة اسمها incisal embrasures اللي هي الزوايا بين الحد القامة تبع الأسنان. The angles between the incisal edge of the anterior. إذا فتحنا الانجلز هاي، فتحنا الزوايا هاي، عملناها زوايا منفرجة. صح؟ منفرجة. إذا فتحنا الزوايا هاي, we will give the optical illusion that the teeth are longer than they appear. I will ask my lab technician, Mr. Technician, معلش لو سمحت, I want you to put some vertical lines بالveneer stratification. The vertical lines will also give the optical illusion إنه الأسنان أطول ما هي عليه في الواقع. Then you analyze. Then you act on the mock-up. Once you act on the mock-up, everything is tested قبل ما نبلش العلاج. So before you start the treatment, you show the patient the result. فرجيه النتيجة. Do you like it? Yes, no. طبعا رح نفهم كيف how this mock-up works out. And then you assess whatever is doing. لأنه في نقطتين مهمة. في عندنا patients مرات بيجوا they have very high expectations. أكيد مرة 3 months ago جتني مريضة. She pulls her phone out of her pocket and she starts scrolling بتطلع لي صورة. فرجيني هيك الصورة. It was a picture of Angelina Jolie. You know Angelina Jolie, صح؟ مرته لبراد بيت. So she puts the picture and she's like, I want to look like her after the treatment. So to me, I understood that the patient had very high expectations. توقعاتها خيالية. She expects إنه مجرد حعمل فينيرز وجهها حيتغير. لا, I'm sorry, you need to go to a plastic surgeon. I can't do that. I don't do faces. I can try to make her teeth look like it. So analyze the expectations of your patient. This short video will tell you my workflow in my practice, and this is technically every step we're going to be discussing in the next few minutes. What you see is a smile, but in reality, it's much more than that. Perfection is not necessarily what I see when I do smile makeovers. Of course, there are a certain number of parameters that I need to follow, among which would be the size, the shape, the proportions, the dimensions of the teeth. Beyond that, what takes it to the next level is to be able to give your patient a unique smile, to try to mimic nature and give them a smile that reflects their personality and becomes an integral part of their identity. In terms of the workflow I follow, I think an integral part of it would be the iconography, but also videos. I take a short video of each patient to get to know my patients a little bit better. The three-dimensional smile design will be translated later on into the patient's mouth through what we call a mock-up, where the patients can actually see their outcome, the results, before even starting the treatment. My role here is to be able to not only understand what they expect, but also to be able to translate that into the final outcome. I think if I had to go back to all the smile makeovers I did and analyze the reaction of most of my patients, I think the first number one thing that most patients would eventually assess after getting their new veneers would actually be a huge boost in their confidence. Not many things in the world would beat that effect you get when you show your patients their new smile in the mirror. You know, the feeling we as professionals have of satisfaction when the patients are amazed with their new smile is just, you know, one of a kind. So I think that's what drives the passion in doing what we do. Indeed, that's what drives the passion in doing what we do. So passion is important. And I want you to remember the first number one thing I said بأول الفيديو. Perfection is not what I see. We'll come back to it عن طريق a clinical case that we will be sharing at the end of the presentation. الخطوات, to make them clear, porcelain veneers workflow. أول شيء case selection. Case selection is very important من كل النواحي. من ناحية إنه المريض لما بيجي عندي I have to understand هذا المريض is he a candidate for veneers ولا لا؟ مش كل مريض is a candidate for veneers. أحكي لكم القصة صارت معي when I first moved to Dubai 2008 تقريبا. I had a patient who had veneers, 6 upper veneers, then the patient disappeared. One of those patients in the بيعمل case and then he never comes back for follow-ups, ما بيجي يعمل clinics. 5 years ما شفته. Patient had سلسلة مطاعم بدبي. He was an owner of multiple restaurants. So well educated patient مستوى معين يعني متعلم إنسان متعلم. وبعد 5 سنين دخلت بواحد من المطاعم. I was having dinner in one of his restaurants. So التقيت فيه. I bumped into him. كيفك؟ X خلينا ما نسمي اسمه. X كيفك؟ شو أخبارك؟ How is it going? Good. And while the patient was talking to me, I could see the gums. اللثة تبعه ورمانة. Like it was red. And to me, that was my work 5 years later. Surely بعد 5 سنين, this is what it looked like. It was one of my first cases with Dubai. So I was like, X, should you come to the clinic, you know? I haven't seen you in a while. خليني أشوفك نعمل check up and stuff. طبعا البيشنت لا إجا. Well, I asked the reception to call him. حكوا معه كذا مرة. أخذ مواعيد ما أجا. أخذ مواعيد. كلكم بتعرفوا هالنوعية من المرضى. بياخذ مواعيد ما بيجي. بعدها ب4 شهور إجا لحاله. كان عنده بيريكورونايتس. موجوع. So he comes in. طبعا أنا ركزت على الفينيرز. I wanted to know شو اللي عملته غلط. Did I violate the violation? هل I overcontrolled my veneers? هل في excess cements تركتهم? I have to make sure that I did not make a mistake because that was my work 5 years later. So I do my periodontal probing. I send him for CBCT. Everything looks good. Everything is neat. I was like, hey, what's going on? فلفت قلت عنده. I was like, X, does it bleed when you brush your teeth? يعني بينزل دم لما بتفرش اسنانك. رد علي شو بيقول لي؟ بيقول لي دكتور بتعرف اني جوزت واحدة ثانية؟ قلت له والله مبروك. قال لي الله يبارك فيك. قال لي بتعرف معها جيزة ونقلت البيت وستاف وهيك من 4 شهور ضاعت فرشة اسنان. قلت له طيب وبعدين؟ يعني انا مستني شو صار بعدين؟ بيقول لي ضاعت. قال لي وما فضيت اشتري فرشة اسنان ثانية. واو. And then He told me what? بس ما تخاف دكتور. أنا عم بضبط كل يوم. I use Listerine every morning. And to me, لما حكى لي الكلمة هاي, what sounded very common, very basic for me, إنه المضمضة الشيء والتفريش شيء, بالنسبة لمريض ممكن ما doesn't make a difference. He doesn't understand that brushing is mechanical. It's about plaque removal, not about the mouthwash. طبعا he was using the mouthwash to have a fresh breath, بس in reality ما كان فهمان إنه في فرق كبير بين الفرشاة وبين المouthwash, and I blame myself for it because I did not educate my patient. I should educate my patient. OHI, oral hygiene instructions. درستوا عليها اليوم وانا بالجامعة أكيد. OHI. I should have done the OHI deserved. حتى بعدها يعني at the end I gave him 3 electrical brushes. 3 فراشة كهربائية. فبيطلع فيني هيك بيقول ليش 3 دكتور؟ أساسا إذا بتتجوز الثالثة؟ قلت له لا. الأولى للمرة الأولى، الثانية للبيت الثاني. الثالثة لا سمح الله إذا نمت بالسيارة بتلاقيها. So case selection, diagnosis. طبعا diagnosis ما راح احكي لكم indications, contraindications of veneers. This is like the university lecture. It's very basic. But we know what indications are, what contraindications are for veneers. Age of the patient is the most important thing بطلع عليه. طب معلش خلينا نشارككم شوي عشان تصحصحوا معي. كم واحد فيكم اشتغل veneers من قبل؟ ارفعوا ايدكم. أنا كمان اشتغل. مش عيب اللي يشتغل عادي، بيشتغل كلنا بيشتغل فينير. طيب السؤال الثاني بسألكم اياه، كم واحد فيكم بده يشتغل فينيرز بحياته واللي بيشتغل بده يشتغل اكثر؟ كلنا صح؟ اكيد. والا ما كنتوا قاعدين السبعة ونص 8 عم تسمعوا المحاضرة صح؟ طيب السؤال الثالث، كم واحد فيكم عامل فينيرز؟ 1 person. شفتوا how this is how hypocrite we are. So we have to understand, and the veneer is not like something, it's not artificial nails you put on your nails and you take them out. في indications, في contraindications. أنا بالنسبة لي أول شغلة بطلع عليها عمر المريض. When a patient aged 20, 22 years old, I don't want to put veneers on her unless there is a clear indication. مثلا tetracycline discolorations, fluorosis, amelogenesis imperfecta, can I do veneers on it? أكيد لا. But I would do veneers on a patient when there is a clear indication, or a large composite restoration, maybe. But someone who has nice teeth, بس بدها أسنان أفتح, or بدها تسكر diastasis, then I send her to whitening, I send her to ortho. مش راح أحط veneers, because you know what? The moment you touch a tooth, it's the beginning of the end. It's no longer the same. Once, even if you do non-prep veneer or minimal prep veneer, you have to understand that non-prep veneer is the biggest lie of the century. I mean, I do non-prep veneers, but it's rare. نلاقي indication of a non-prep veneer, it's very rare. You know why? Because رقم واحد, you don't have enough thickness, you end up with cervical over-contouring على منطقة الجنجفة, which will allow food accumulation. Hello? Second thing, bonding is compromised. حتى إذا thickness, we can do minimal thickness veneers. Bonding is compromised. لأنه when you bond on prismatic enamel, اللي هي نعرف إنه outer enamel layer is rich in fluoride and highly resistant to acid etch. So you have to sandblast with aluminum oxide. Usually we sandblast 40-50 microns aluminum oxide. So sandblasting is going to remove the outer enamel layer. In other words, لا أعمل finish line أحسن لي. At least I preserve the soft tissues. At least I tell my lab where to stop. I don't mind doing مثلا non-prep veneer on a peck-shaped pattern. Peck-shaped pattern ليش؟ السن صغير. تعرف peck-shaped pattern صح؟ السن صغير فبدي كبره. بدي سكر مسافات. وما راح أغير لون. أنا عم بعمل 1 veneer ما عم بغير لون السن. همشي على نفس لون الأسنان الثانية. فممكن أوقف أرسم على الكاست. الفينير يوقف شي نص ملي أو 1 ملي سوبرا جنجيفال عشان ما يصير في cervical overcontouring. This is a case I don't mind. But otherwise, or if the patient has a very low lip line and I can manage to stop the veneer away from the cervical margin, I don't mind. Otherwise, you can't, and you still have to sandblast. So don't follow non-prep veneers as being the evolution. Believe in minimal prep veneers. As non-prep veneers is to be avoided. Tamam. So moving on to the next step, the treatment planning phase. The treatment planning phase طبعا احنا عندنا مثلا دزار يقول لك يد واحدة ما تسفق. بتقولوا هيك نفس الشيء بس بطريقة ثانية. ايد واحدة ما بتسفق. It's dentistry is not a one-man show, especially for the young ones. ما تفكر حالك جونجا، تعرفوا جونجا؟ ما بيعرفوا الصغار شو they wouldn't know. Anyways, ما تفكروا حتى إنه you can do it yourself. لا. You have to understand that dentistry is a multidisciplinary approach. Don't hesitate to consult from the beginning with a periodontist مثلا في حالة عندنا crown lengthening, for example. Crown lengthening. My patient has a gummy smile, you need to correct the gums, reduce the exposure of the gums. Like, don't you want to discuss it with a periodontist? صح? And the best way is to do the smile design قبل ما تعمل a crown lengthening and then guide the periodontist into the crown lengthening procedure. So multidisciplinary approach is where you have spaces, diastemas, crowding. You want to do some ortho بعدين veneers, or you might be just ortho, or maybe close a little bit of the spaces with insectable veneers. So you have to have a multidisciplinary approach. الخطوة الثانية اللي هي الفوتوغرافي، الايكونوغرافي بقى صح. Photos and videos are mandatory. طبعا رح نفوت بالتفاصيل of each one. And at the end, the initial impression. Usually when we take an initial impression, we will take it with alginate. When I do smile makeovers, I never use alginate. I will use putty, silicone material, more specifically PVS, polyvinyl siloxane, addition silicone. Yeah, putty light, yeah, heavy light, whichever you want. But I would use a silicone impression. Why? Because it's an impression I might have to pour more than once. طبعا فيني اخذ alginate واخلي اللعبه يعمل لي duplicate للموديل. بس when تعمل duplicate للموديل you lose details. طبعا if you scan it's even better. If you have a digital scanner, I don't know how common digital workflow. I've been working digitally for the last 7 years. I'm almost a full digital workflow. But I still lecture about analog because I know الودارج اكثر شيء بيشتغلوا الدكاتره في الوقت الحالي هو الانالوج. So I'm here to teach you things that you can start working on tomorrow. So take your initial impression using the silicone. بعدين thanks to the photos طبعا الصور راح تسمح لك نعمل digital smile design. So you will start with your smile design. 2D, 3D, it's up to you. It's up to the tools you have. سواء 2-dimensional, 3-dimensional, سواء you use software ولا you use Keynote and PowerPoint. You can use PowerPoint for a smile design. So you do your smile design. Your smile design will give instructions to the lab. If you have an analog workflow, you give measurements, the lab is going to execute whatever measurements you give on this picture على الWhatsApp. تمام? Then the WhatsApp comes. So the WhatsApp, the second picture here, you have the WhatsApp. This is if you have an analog workflow. If you have a digital workflow, it's more simpler. You eliminate the human factor. ما بقى تحتاج اللاب لأنك أنت you will do your 3D smile design. تدعس على زر. If you have a 3D printer, بيطلع لك 3D printed WhatsApp model on the spot. فوق الWhatsApp طبعا موديل رح نعمل silicone key. This silicone key has to be made of a condensation silicone, not an addition silicone. تعرفوا condensation silicone which is what it is? Is the lab silicone, is the big jar base and catalyst or activator. So you're going to use a condensation silicone. Why? Because condensation silicone will give you rigidity. And your silicone key has to be rigid. So the only way you guarantee that you do a good mock-up, because you have to understand, لما تقول للمريض رح فرجيك النتيجة قبل ما بلش العلاج، معناتها ايش؟ معناتها المريض مستعد نفسيا انه يشوف النتيجة قبل من غير ما تلمس اسنانه. So the trick about an emotional mock-up is to get it right from the first time. You have to do a proper mock-up from the first time. Don't retouch it before you show the patient. Do the mock-up. Do the mock-up with the مريض. The patient can see the mock-up, صح? Anyone has done mock-ups before? Raise your hands. So how do you show your patient the mock-up? تعطيه مرايا؟ كيف ترجع المريض؟ تعطيه مرايا. So commonly make mistake إنه نعطيه مرايا للمريض بالإيد. Never do that. Never give a hand mirror to your patient. The moment تعطيه المرايا للمريض بإيده, you lose the emotional link and you awaken the radical part of the brain. بيصير المريض بدقق على التفاصيل ويقول لك هون teeth are connected. طبعا teeth are connected, it's a mock-up. الأسنان مربوطة مع بعض زي مؤقت صح؟ So it's a mock-up. هيقول لك والله في bubbles هون في bubbles. So he's going to focus on details and he's going to pinpoint things that are not worth it. Don't give a hand more. The best way to show the mock-up to your patient is to take photos, portrait photos, صورة لوجه كامل. And then take a video. Show him the video before, the video after. That's what Coachman describes as emotional dentistry. طبعا 99.9% من patients they will still want to look at themselves in a mirror. المريض يشوف حاله بالمراية. If they want to look at themselves in a mirror, ask them to go up to a wall-mounted mirror. يروح على مراية بالحائط وما يقرب عليها كثير. The idea is to show the overall outcome, how the shape of the teeth matches with the shape of the face, the personality of the patient. So don't let him get too close.
Some patients will go very close to the mirror and start pinpointing the effect. تعرفوا شو بتعملوا؟ تاخذ عصاية وأول ما يقرب تضربوا فيها. Or maybe you just keep a small decoration. إشي يخلي مسافة بينه وبين المرايا. Sink, artificial plant, whatever it is, to keep a distance between the patient and the mirror. So you do the mock-up. If the patient approves the mock-up, let's say the patient tells you, you know what, amazing, I love it. Let's go. We can start prepping the teeth on top of the mock-up. That's what the deep cuts are called. So you keep the mock-up inside, and the mock-up يمثل النتيجة النهائية. فuse the mock-up to guide you into the depth of preparation. إذا مريض قال لك والله I want slight modifications، السنترز مش عاجبيني بدي إياهم مدورين شوي. I want to lengthen the canines. Do chair side modifications. غير on the spot، خد فلوبل كومبوزيت، طول السن، قصر بالديسك، عدل اللي بدك تعدله، بس ما تنسى once you modify the mock-up chair side بدك تاخد صور and you take a new alginate impression this time. طبعا if you scan, you scan. Alginate impression, you send it to the lab and you tell the lab the reference you have now is no longer the small design of the wax up اللي عملناها أول شيء. Your new reference هلا صارت ايش؟ the alginate impression I'm sending you. طبعا ليش alginate؟ عشان ما يطلع mock-up للimpression. Okay? Then, boom, you move on to the next steps, preparation, provisionalization, impression, and bonding. I rarely take the impression on the same day of preparation. I usually prep, temporize, make sure your temporaries are well finished, highly polished, well adapted to the margin. خلي المريض يروح 3-4 days. Chlorhexidine 0.12% mouthwash. For 3-4 days, patient comes back, the soft tissues are completely healed. It's easier for you to prepare. حتى if you have to modify a little bit on the prep, you can always do. You pack your first cord, you pack your second cord if needed, and then you move on and take your impression. هلا خطوة خطوة. Iconography. حكينا عن التصوير. هلا في مجموعة من الصور بتتاخذ in the dental office. الصور هاي بتساعدك لدراسة الحالة و communication with the lab. One of the most important pictures اللي باخذها هي 12 o'clock position picture. بنيم المريض in a supine position and I take a picture from the back of the patient of the incisal edges with the lower lip curvature. This is one of the most important pictures لأنه هاي حتحدد طول السنترال incisors وقد ايه فينا نطول منهم. بعدين في مجموعة صور بتتاخذ in a studio setting. الصور هاي للdigital smile design to decide and determine how many teeth show in a natural smile. طبعا which is very common مرات لما ناخذ صور. You ask the patient to smile and then they have a forced smile, a fake smile. What I do usually is when I do the video, I mean of course I'll take the pictures that we talk about. So the first picture I take usually of my patients is the patient with the lips sealed, الشفايف مسكرة. بعدين بخليها تروح تسمايل, smile, maximal smile. تمام. Next picture will be open smile. So the patient opens and smile. And then another picture after pronouncing the letter M. M will put the lips in the rest position. That's the amount of visual display I have of the central incisors. بس الأحلى من هيك اللي بعمله إنه I take a video as well. باخذ الفيديو وأثناء الفيديو بصور المريضة أو المريض وهو وهي بتضحك. ليش؟ Because that's a natural exhibition of the smile. فطبعا هي نكتتين the same jokes I crack every time and they work. بحط النكتة المريض بيضحك بصور. So you'll see it now. So she's talking طبعا. The patient is talking. Then I'm going to crack that joke. 1, 2, 3. She's going to laugh. And I take a picture while taking the video. طبعا the video you can take it with your iPhone. You don't have to put it to use a DSLR camera. iPhone works very well. حتى أنا لاحظت إنه most patients لما نحطهم بالstudio settings طبعا هي نقطة كثير مهمة. By the way, a studio setting is cheaper than twin flashes. يعني it's not expensive. يعني $250 you can have a full studio. If you get things online, it's not expensive at all. If you just have to have the space for it, it's as expensive as a rain flash. Rain flash is not the kind of light we want to use. When we take pictures for aesthetic dentistry, we want to use lateral source light. Yeah, soft boxes, yeah, twin flashes. Twin flashes are expensive. Soft boxes are much more cheaper. وكمان تعطي prestige للعيادة. You have a small studio in your practice. Yeah, بغرفة separate, I have a separate room, or you could do it also in your office. إذا عندك زاوية صغيرة ممكن تحطوا soft boxes. بس I realize لما المريض بيكون قاعد بالسبورت لما تيجي تعمل فيديو patients don't feel comfortable in the beginning so give them time to adapt خليه يقعد 5 دقائق قبل ما يتعود على الجو or film with a cell phone most patients feel comfortable in front of the iPhone بتصوروا تلاقيه هيك خلاص ماخذ راحته لانه they're used to doing videos especially the young ones with TikTok and Snapchat and مش عارف ايش اللي بيطلعوا لنا كل مره حاجه جديده. So راح تشوفوا through these videos هذول 4 different patients 4 different ethnicities واحد إيطالي one is French one is Italian one is Persian one is Vietnamese each one has complete different backgrounds and you will see how they will react بس معلش ال IT موجودين؟ وطينا الصوت هون لأنه حيطلع كثير قوي. So you see how each one of them will react differently. We don't want the audio, but you will see that, for example, this guy is having the mock-up inside his mouth. Now we did the mock-up, okay? You can see how he's avoiding eye contact with the camera. Look at the other patient. She has a cleft lip, all right? Look carefully, and through the video, I will see that the lip is lower on the right than the left. A photo or a clinical examination will not show me this. So this video will have 2 functions. One, to analyze the personality of the patient اللي حكينا قبل. Personality is strong, dynamic, delicate, calm. 2 is to analyze the relationship of the teeth with the lips. Look at that patient on the other side. Same thing, you can see that this patient has a mock-up in her mouth now, and you will see, حتشوفوا بعد فترة, her canine, the tip of the canine will slightly touch the lower lip curvature. بتعرفوا ايش معناتها هاي؟ This will determine the position of the incisal edge of the centrals. Because the general rule is the incisal edges of the centrals will be at the same point of the tip of the canine, with the tip of the canine slightly touching the lower lip curvature. معناته انه I cannot go beyond that. And if we look at the last patient, طب خلينا نشوف هذا المريض من ناحية ثانية. Because احنا حكينا الفيديو عندنا دورين. الدور الأول, which is what? To analyze the relationship of the teeth with the smile, and the door الثاني is to analyze the personality. Let's focus on the patient's personality. You have no audio, ما في صوت بالفيديو صح؟ ما عم نسمع عشان يصير. والفيديو is less than 20 seconds. بس إذا طلعنا على الفيديو مرة ثانية. Let's go again. Alright. Up. Focus على الشاب الأصلع. He's a French football player. ركزوا عليه. The video is 20 seconds. طلعوا على الفيديو كويس. Look at him not as a dentist, as a psychologist, as a psychiatrist. Look at him. Don't give him medications though, huh? Would you say he's strong? No. Would you say he's dynamic? No. So it's easy to determine. You know that he's either calm or delicate. How do you determine whether he's calm or delicate? There is a very interesting questionnaire online. It's called ISENC personality questionnaire. ISENC is for ISENC was a psychiatrist and his wife was a psychologist. And they put a questionnaire back in 1979 that who determined the personalities, and it gives you questions, random questions. مالهاش علاقة بالأسنان، أسئلة عن شخصية المريض، عن العادة، habits of the patient. And this patient was delicate. Delicate is associated with the shape oval. صح? And look at the shape of his face, oval. So the first thing I will think of is to give him oval central incisors. لما بيجي بعمل smile design, I already know أن الأوفل will look nice on him because it will match his personality and match his and the shape of his face. So بعد الصور عندنا digital smile design. Digital smile design راح تختصر طبعا digital smile design بياخذ يومين لحاله. بس راح تختصر بالصورة هاي. إذا بتطلع على الصورة هاي راح تشوف إن الصورة هاي تعطيه مجموعة من المعلومات. طبعا this is 2D. If you're on 3D, things are much more easier. بس الصورة هاي فيها مسطرة صغيرة. This is called a calibrated ruler. وفيها أشكال جديدة للأسنان with measurements. معناتها إيش؟ I'm telling my lab technician, listen up. طول لي اللاترال هون نص ملي. الكناين بدي إياها شوي أكبر 1 ملي. This one will have you 1 milli more. And then look at the right side. راح طول الأسنان، بس راح طول الأسنان cervically. ما راح طولها incisally. So digital smile design is not only a way of communicating with the lab, it's also a way of treatment planning. A smile design is a mean of communication. أنا دائما بحكي the dentist الدكتور بيحكي مع اللاب بالسمايل ديزاين. اللاب بيجاوبوا بإيش؟ بالواتساب. الدكتور بيحكي مع المريض بالموك اب. So it's a chain. So with this picture, I'm telling my lab, على الكاست على الموديل, he's gonna do crown lengthening, حيشيل من الباستر موديل من ناحية اللثة نص ملي على اللاترال 1.5 على الكيناين 1 ملم 1 ملم حتى ممكن أعمل guide like a vacuum tray guide or a 3D printed guide و I send it to the perio وهو بيستخدمه للcrown lengthening. تمام؟ So, and look at this picture. شوفوا between 1.3 and 1.4. Did you see these two lines overlapping with one another? Just here? Do you know what this means? شو معناتها؟ معناتها إنه I'm gonna change the dimensions تبع الأسنان. راح أعرضها. Which means I will have, when I do my preparation, I will have to open the contact. Do a slice preparation. So this is one of the indications. بقول لك طب إحنا بنفتح contact تلقائيا لما نشتغل في نيز؟ لا. Preserve the proximal enamels unless عندك caries. Unless عندك filling. Unless you're changing the dimensions. So the smile design is guiding me with preparation mesiodistally, صح? والmock-up is guiding me in the depth of preparation. It's exactly like a pilot flying a plane on autopilot mode. You prep through the mock-up, it will give you the depth. You prep following the smile design mesiodistally, it will tell you when to open the contact and when not to open the contact. If you have a digital workflow, things are much more simpler. You print out a 3D wax-up, so you do your smile design, you have a 3D printed wax-up model. This 3D printed wax-up model will allow you to transfer mock-ups. أنا بالنسبة لي, I don't show a smile design. ما بفرجي صورة smile design للمريض. To me, the best way, because خاصة if it's 2D, if it's two-dimensional, I mean, look at this picture. Some of you will say we see ships, others will say it's a bridge. كل واحد بيشوفها من a different angle. But what I want to show the patient is the mock-up. يشوف الريزلت in his mouth. So mock-ups زي ما حكيت الخطوة الأولى اللي بعملها is to do a direct mock-up على central incisors.